Good evening, everyone. I am Dr. Nandini, and welcome to this seminar on recent advances in the management for autism, cerebral palsy, and other neurodevelopmental disorders. Some of you may have already attended some of our webinars before. I hope a similar webinar today will help you further understand the logic, get a better understanding of what the neurodevelopmental conditions mean, what happens in the brain, and what can we do to help these children improve in their function and the quality of life. So why are we here? We are here because either we have children with autism, or we are caretakers of children with autism, or cerebral palsy or intellectual disability, or we are a professional who are associated with these children or want to know more about what's new in the field of treatment or management of neurodevelopmental disorders. So what is the current treatment paradigm? What kind of treatment do we have currently? One, we know that, or we have been told again and again, that there is no cure for autism, there is no cure for cerebral palsy, there is no cure for intellectual disability, that there is no surgical intervention, there is no operation on the brain that can be done. For example, if there's a tumor, you can operate and remove the tumor, or if there is a problem in the brain, here we cannot really cut open or intervene or do any surgery. Only rehabilitation is possible. Only training, occupational therapy, speech therapy, only this is possible. And no medicines can really cure the condition. Medicines can help reduce hyperactivity, or it can help reduce the tightness or spasticity, or it can help to reduce the seizures. But no, there is no comprehensive treatment which can actually address the problem in the brain. This is what you have heard so far. So what is new? What is different that I'm going to talk to you about today? What I'm going to talk to you about is, along with rehabilitation, we have two new team members in the treatment or management of neurological or neurodevelopmental condition. The two new team members, one of them is cell therapy, and the other is our integrative therapies or oxygen-based therapies. These two add on to the rehabilitation and help improve the brain performance. So basically, that you have an old team which works, but it works to a limited extent, and adding the new team members adds on to the holistic treatment. So, for example, you have, suppose, I'm sure that many of you have, gone through this fractures, or somebody in your family or somebody in your friend or in colleague must have at some point in their life had a fracture of a hand or a leg. So what do we do if there is a fracture? For example, a fracture of the leg, you can see that the bone is broken. Do you go and start walking on the broken bone immediately? No, because we know that if we walk on a broken bone, the bone will further worsen, the swelling in the leg will become more, and walking will then become impossible. It starts paining, right? There's swelling and pain. So what do? We go to orthopedician. Either we get a splinting done, or we get a plaster put so that the bone heals. And once the bone heals, that's when you are advised to put weight bearing, or you are told to do physiotherapy to strengthen the muscles. So if that is the case for the bone, then why not for the brain? When we look at the brain and we see that there is a damage in the brain, as in case of cerebral palsy, or if there is a part of the brain which is functioning less, and in this low functioning brain, now we push the child to do training, therapy, obviously the child will cry out, will have behavioral issues, will not agree, because he or she is incapable. And we are pushing a child who is incapable of doing certain things. So what is important, just as it is important to heal the bone, it is important to heal the brain. You can see here, this is the brain. The blue parts are the areas which are damaged or functioning less. And with the cellular therapy, the blue part is becoming green. Now the brain is healing. And as the brain is healing, now you do the training, now you do the rehabilitation. The child will be more accepting of this training and rehabilitation, and you will see better results. So what was the old dogma or old thinking? That once the brain or the central nervous system is damaged, it is incapable of regeneration. This is a very, very old school of thought. It is almost like 30, 40 years back, it was started to get refuted. And the new thinking is that now we know that it is possible to regenerate the brain. We know that there are certain cells or certain areas in the brain which continue to multiply and regenerate and continue to connect. So to these areas, we are supporting with cellular therapy. We are giving a raw material to help regenerate or revive the brain functioning. So yes, it is possible to regenerate the brain. So till now, we only had rehabilitation. Now, along with the rehabilitation, we also have cellular therapy and we have integrative therapy. And together, cellular therapy and integrative therapy, along with rehabilitation, it is now possible to reverse autism or cerebral palsy. So it is not a science fiction, it is not futuristic, it is possible to do it today. And that's what I'm going to talk to you about. So cellular therapy is not as I said, a futuristic science. It is an idea whose time has come. Till now, we knew only about two type of procedures or treatment modalities, right? We knew that either you can, if you have a fever, you take medicine or you take an injection, or if you have a brain tumor, you have a surgery, or if you have a fibroid, you remove the uterus. So it is a surgical procedure. So far, treatments were of only two types, medicines or surgical procedure. What we are introducing now is a new concept of cellular therapy. And that's why it is difficult, it is important to understand what this is and how is this different from a medicine or a surgery. So this is a new treatment protocol that we are introducing, which will help children who are sitting on a wheelchair to stand and walk, those who are unable to go to school to be able to go to school, those who are unable to speak to be able to speak. So this cellular therapy or regenerative medicine is similar to the stem of a tree. Here you put seed and you get a sapling. And from this sapling, if you give proper fertilizer, you give proper water, you get leaves and flowers and fruits, right? So that's what these cells are doing, and that our body has regenerative capacity, which Hawking is going to talk about.
I have spent my life exploring the mysteries of the cosmos. But there's another universe that fascinates me. The one hidden inside our bodies. Our own personal galaxies of cells. Today, we are on the brink of a new age in medicine. An age where we will be able to heal our bodies of any illness. All because of cells inside us, which have special powers. They are called stem cells.
Okay, so in our body itself, there is a special power. We keep looking for treatment, or we keep looking for help from outside. But even our own body has capacity to repair and regenerate. And that's the capacity of our body to regenerate is what we are going to harness now. We are going to use that. And that is the power of cell therapy. Now, the cell therapy originates from stem cells. Now, stem cells, what do? They have certain characteristics. They multiply. One cell can become many, 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 many cells. That is different from a normal cell. So it has potential to multiply and become similar cells or clones of their own, number one. Number two, it stimulates formation of new blood vessels. So suppose you put the cells in the liver, there will be more blood vessels or new angiogenesis in the liver. If you put it in the brain, near the brain, then there is more blood formation or blood vessel formation in the brain, and thereby increase oxygenation in the brain. The third thing that these cells do is, depending on the environmental signals or cues they get, they can become the cell of that particular area. So if you put them in the bone, they can become bone-like cells. If you put them in the brain, they can become brain-like cells. And the fourth thing is they stimulate, they release positive chemicals and growth factors, which will help to repair or rejuvenate the nearby areas. So they can repair, they can regenerate, and they can replace damaged tissues. So how are stem cells different from drugs? Okay, so let's look at this example that way back in 1990. Suppose you had to do a calculation. You needed a calculator. Okay, suppose you had to click a photograph. You needed a camera. If you needed to watch a television, you actually needed a television set. If you needed some light, you needed a torch. If you needed to read, then you needed a actual physical book. So that was few years back. But now today, with the advent of the smartphone or iPhone, the phone itself does all these functions, multiple function and multitasking. That's what the cellular therapy or stem cell does. It has multitasking functions. It can do many things which one drug cannot do. So it is a combination of many drugs put together. One cell can achieve so many functions. So regenerative medicine or cellular therapy is a promising therapeutic modality which involves the use of healthy cells to replace the damaged cells. So here you are seeing an example of a brain scan known as a PET scan. The blue areas are damaged, and as the cells go in, they repair the blue area and improve the functioning of the blue area. Okay, now there are two types of transplantation. So these cells need to be put into the area where you want them to repair. Okay, so either you can take cells from your own body and put it back where it is required. It is known as autologous, from your own body to your own body, or it can be allogenic from somebody else to our own body. So these are two types of cell therapy or cell transplantation. Okay. Now, where do these cells come from? Okay, so it's important to know the source. Can you go to a shop and buy the cells? Not yet. Maybe in the future you may have that option, but today we have to produce these cells. So the earliest production that we see is in our own body. When a child is in the mother's womb, the child is a one cell stage, and then 2, then 4 and 8 and 16, and becomes a bundle of 32 cells. From here, when the stem cells are created or cultured in the laboratory, then these are known as embryonic stem cells. And embryonic stem cells have the characteristic or have the potential to form all the cells of our body, including the placenta. So they are known as pluripotent and or totipotent. That means they can form all cells of our body. Maybe theoretically they can form a full child. However, they also have the possibility of forming tumors, and hence these cells are not to be used for treatment. They are very good research modalities or cells which can be used to test drugs outside the body. The second source is the cord blood. We know that a mother and child are connected to each other by cord, and when the child comes out, you cut it, and this cord is then put in the garbage. This cord is a very rich source of stem cells, and these stem cells can be used for various conditions. Right now, they are more indicated for blood disorders like sickle cell anemia, thalassemia, and blood cancers. So these cells also can be used if stored. However, for conditions such as brain conditions, it would be difficult to give them into the spinal fluid. They can be given intravenously. The third source is from our own body. If we don't have the cord blood, what do? We can take cells from our own body, from the bone marrow. Bone marrow is where blood is being formed. Okay, it is the factory of blood, and new blood is formed every day. So bone marrow is a source of stem cells which can be used to treat our own body issues. So, and there are no tumor formation, there are no ethical issues. We are not killing an embryo, and we are not transferring it from somebody else, so no rejection issues, and hence use of bone marrow cells becomes a very good medium for treatment purposes. So this is a feasible option and can be used in treatment of brain conditions. Now, there are a lot of myths that, stem cells are banned, or stem cells can have a lot of side effects. So when you say stem cells, it is, as I told you before, it is important to distinguish the source of the cells. Okay, if they are from the embryo, then it is possible that they can form tumors, and that because of ethical issues in US, federal funding for embryonic stem cell research was stopped. So embryonic stem cell is like alcohol, while using our own cells, which are not killing an embryo, which are our own cells, which do not form tumors, is like homemade orange juice by the mother, right? So we at NeuroGen use the patient's own bone marrow because they are safe, they are non-tumorogenic, they do not form tumors ever. There are no rejection issues because we are taking from the child's own body, putting it into the child, easily obtainable. Okay, they're easily obtainable because using a very thin needle, no cut, no stitches are required, and no ethical issues because we are not killing an embryo here. We are taking from the patient's own body, so no ethical issues. So bone marrow is the source of the cells. I'll be telling you how they are processed. And then once the cells are formed, they're injected in the lower back. You can see here the patient is lying on one side, and in the lower back between the two bones, the needle will go here. Okay, as the needle goes into this place between the two bone to the cartilage, it will go into the spinal fluid, and this fluid goes all around the brain and spine. The cells will go to the part of the brain which is damaged. So there is no cut, there is no stitch, just one needle in the hip bone and one needle in the lower back. So minimally invasive, safe, no major side effects, and these cells will directly home on or go to the injured part of the brain, and it doesn't get diluted into the liver, lungs, spleen, anywhere. So how can these cells be introduced into our body? Depending on where do you want cells to go. The easiest way of introducing is intravenous, right, into the veins. But when you put the cells into the vein, here you can see these cells will go through the blood into the right side of the heart, and then they get pumped to the lungs where it gets purified, and then it comes back to the left side of the heart, and then it gets pushed to the whole body and some part to the brain. So during this process, a lot of cells get, almost 50% get trapped in the lungs. So the number of cells which eventually reach the brain do not know. So the efficiency becomes very less. So what are we doing? The second way, it can be that you can inject the cell directly into the brain here. Yeah. Again, this is a more direct route. However, it is risky and it has a possibility of side effects, including death. So one is a simple way, efficiency is low. The other is a direct way, efficiency is more, but risk is also more. So what we have found is an in-between way where we put the cells into the spinal fluid. So the cells will reach directly into the brain without dilution. We are not going directly into the brain, so we are not injuring the brain. So this is a simple, minimal, invasive, and safe way of introducing the cells in the vicinity of where we want it without damaging. So what is the scientific basis of the cell therapy? It is, has it started yesterday? No, there's a lot of research, and way back in 1990, Nobel Prize was awarded for the demonstration of stem cells in the bone marrow. So Nobel Prize, one of the highest award for any kind of work in the field of science, economics, literature, was awarded in 1990 for the demonstration of cells in the bone marrow. That's what we use. In 2007, Sir Martin Evans got the award, second Nobel Prize for stem cell research, that is isolation of embryonic stem cell research from mice. And the third Nobel Prize was shared by two scientists in 2012, and this is for another new technology known as induced pluripotent stem cells. So a lot of research is happening in the field of stem cells. It will keep on evolving, new things are coming, but the oldest and most tried and tested is the bone marrow that we can see. What is the scientific basis of the work that we do at NeuroGen? So let's look at NeuroGen. In NeuroGen, in the last 15 years, we have published 107 to 108 publications. And these are not newspaper articles. These are scientific publications which are peer-reviewed. What does that mean? That other experts in the field have scrutinized the information, the data that we have sent to these journals for publication. They have approved it, and that's why it is published. So all the research, all the work that we do is published. 16 publications in autism, 15 in cerebral palsy, 4 in intellectual disability, 18 in muscular dystrophy, 9 in spinal cord injury. So the number of publications also shows the body of work that we do, the credibility is on the publications. This is very important that it is scientifically validated. Also, there are various international books written on various topics, such as recent advances in autism, challenges in cerebral palsy, a book on physical disability. And when these book editors want to introduce chapters on cellular therapy or stem cell therapy, they reach out to us. That shows that we are known as experts in this field all over the world, not only in India. And we have written book chapters in textbooks on stem cell therapy in autism, stem cell therapy for cerebral palsy, a novel option, then a book on physical disability, therapeutic implications, again a book on pediatric neurological disabilities, a chapter on stem cell therapy in muscular dystrophy. This is our Prime Minister, Shri or Honorable Narendra Modi, to whom our Professor Director Dr. Alok Sharma is giving a book on neurological disorders that we have written. And the Prime Minister is very supportive of the cell therapy and is very supportive of cellular in the progress and research. He went to meet Professor Yamanaka, who is one of the Nobel laureates from Japan on stem cells, went and understood and brought this technology to India. He's also written a preface to one of our books on muscular dystrophy.
मैं जापान गया
And he spoke in the
तो
parliament
जापान मेरे कार्यक्रम में मैंने एक
about
कार्यक्रम
his
क्या जोड़ा
interest in stem
मैं
cells
वहाँ एक नोबेल
and
लॉरिएट
his intent to bring stem
साइंटिस्ट
cell
याका महा को
research and
मिलने गया
development in
मैं इसलिए
India.
किया गया
So there's a lot of political will and political support for stem cell research and regenerative medicine. So let's look at how the treatment is done. Is it a big procedure? Yes, there is a lot of scientific background, but of course, parents are worried because yes, it is not supported or validated by a lot of medical fraternity. So it's important for you to have confidence in the treatment procedure. The treatment procedure is very simple and it is very safe. There is no cut, no stitches. One needle in the hip bone, you can see a needle goes in and bone marrow is aspirated. These cells are separated in the laboratory and injected by a thin needle. So just 2 needles as far as the child is concerned. This is a process. You can see the bone marrow is being aspirated. Then it is processed in the laboratory, centrifuged, checked under the microscope, checked for viability, quality, and injected using a very thin needle in the lower back. So this is the very simple procedure. Bone marrow is aspirated, few hours for separation. You can see the cells here are separated. This is a cell, this is a bunch of cells, millions of cells, and counted and injected in the lower back. So now let's look at what are the results. So some published data and some new data, both I'm going to show to you. Autism, we know what autism is. Autism is a triad condition which leads to difficulty in socialization, social communication, social interaction, and restricted and repetitive behavior because of limited interest. And this limits the overall development. It's a neurodevelopmental disorder. It has a spectrum, so children can be mild, moderate, or severe. It is diagnosed more in males than in females. So poor social interaction, impaired communication, restricted repetitive behavior. And why do we need to know about this? Why do we need to find definitive treatment? Because the numbers are increasing. The increasing, you can see in 2004, 1 in 166, in 2020, 1 in 54, now in 2022-23, it is 1 in 39. So literally every 2 years, we are seeing a jump of 5 to 10% at least. And 70 million people on the spectrum in the world, 1% of the world's population. Now parents keep on asking, what has caused this? What really is the cause? Nobody really has a definitive answer, but of course there are a lot of theories. There is a genetic theory, there is an environmental theory, and more often than not, it's a combination possibly of both genetic factors and environmental factors. So there are a lot of genetic factors. We have seen siblings in the family, triplets in the family having autism, a small percentage. And there are different genetic variants which have been associated loosely or very strongly to the possibility of autism. However, how much each genetic mutation really causes and how much environmental factor contributes is still uncertain. So environmental, see, we cannot change the genetic makeup of a child, but we can definitely try and influence the environment positively. So if we know what are the possible environmental influencers, we can try and minimize and reduce it. So prenatal and antenatal causes, such as the stress in the mother's age, if mother has depression, or she is diabetic, or she has hypothyroidism, or she has any infection, intrauterine infection, all these, the nutrition of the mother, the mental status of the mother, all these may contribute to the environmental factors leading to brain functioning affectation. And as a child is born, oxygen deprivation is one of the important and big factor which can lead to brain functioning becoming limited, and thereby then the outside environmental factors also influencing the development or networking of the brain. Intestinal dysfunction in autism, both in the child and in the mother, primarily starts with the mother. If mother has intestinal dysfunction, it may lead to a problem in the development of the child's brain. When the child comes out, if the brain functioning is low, it can lead to the intestinal function being affected, and thereby nutrition not being absorbed properly, and could add on to the problem in the brain. Exposure to toxic chemicals, especially when the child is in the mother's womb or just in early infancy, if the child is exposed to very toxic levels of heavy metals such as mercury and lead, could lead to brain function affectation. Use of mobile phones is one of the controversial query possible causations, either due to electromagnetic radiation when the child is in the mother's womb, and if the mother has been exposed to too much of telephone usage, it could affect the brain development of the child. When the child comes out and the child is exposed to too much of screen time, it is possible that child's external stimulation or environmental stimulation is limited, thereby the brain development which has to happen after the child is born is also affected. So both intrauterine environmental factors as well as the brain environmental factors outside may affect the brain development. So what do we understand about autism through imaging? This is a PET scan of the brain which tells us functioning of the brain. Here is a brain scan where you can see the blue areas and green, yellow, and red area. Okay, these indicate different functioning. The blue indicates low functioning. The darker the blue, more the problem. And the green, yellow, red indicate good functioning brain. So we have looked at which areas of the brain are functioning less using PET scan of the brain, and this we have published in a journal, World Journal of Nuclear Medicine. And what we have found is this. When we look at the brain functioning, the blue here indicates brain functioning in neurotypical individuals or children. As with age, the blue areas increase. The blue line, you can see the brain functioning is increasing. And after 10 years, the brain functioning is increasing, however, slightly slowly. In children with autism, the orange line, you can see that brain functioning seems to be higher earlier, but then it goes down with time. So it is important to intervene early. Early intervention is very important. You have to intervene here and push this graph up. That's why treatment early before 5 years is critical. So when we look at treatment or management of autism, it's a multidisciplinary approach is very important. You have to do rehabilitation, diet, and other treatments together. Let's look at neurorehabilitation. It is again, you need to understand the behavior of the child and try and prevent outbursts, help the child have a better balanced behavior. So ABA is, or behavioral therapy is important. Physical or physiotherapy to improve motor coordination, to reduce the clumsiness and body movement. Postural stabilization is very important. Occupational therapy to teach the child how to eat, how to poop, how to go to the bathroom, how to clean himself, how to play. All this is part of occupational therapy. We also have sensory integration therapy. Now, what happens in children with autism is that there is input, but information processing and sensory integration doesn't happen. What does that mean? It means that, for example, if somebody touches me, I know what this touch means. I know that whether it's a good touch or a bad touch, or if it's too much of a touch or a very light touch, or it's a painful stimulus. So, however, children with autism are unable to process this information, unable to decipher how the touch is, and thereby the response is inappropriate to these sensations. It could be touch, it could be hearing, it could be vision, it could be taste. So all these sensory information processing is affected. So the child has to be taught. That's what the sensory integration does, how to respond to appropriately to stimulation. So this is a sensory integration room where the therapy is done. The speech and language has evolved. Speech therapy doesn't only mean how to teach the child to talk, it also means how to communicate. So it will start with non-verbal and then it will go to verbal. The other important thing is oromotor. Chewing also is a big problem in children with autism and many times in cerebral palsy, and that chewing can be facilitated by a speech and language therapist. Aquatic therapy, exercise in water. Water is a very calming influence on children with autism. Most children love water, and you can make them do a lot of activities in water. So aquatic therapy is very beneficial for autism, for cerebral palsy, for intellectual disability, for muscular dystrophy, and most of the neurological conditions. Art therapy and special education, very important. Now about chelation, yes, it can be done with cell therapy, but we would suggest to keep a gap because we don't want to kill the cells which have been introduced. So wait for some time. Vitamin supplementation can be given. However, I believe that we should try and see whether we can do it through nutrition or food rather than giving tablets or drugs. Your gluten-free, casein-free diet is worth trying. It helps to reduce the gas or gaseous formation in the intestine. It helps to improve absorption and helps reduce constipation. So with all of this, are we doing enough? So we are helping the child from outside with neurorehabilitation and diet, but it's not helping the brain, right? So that's why the cellular therapy and oxygen therapy is very important. So our study on cell therapy started way back in 2008 and 9. We published our first publication in 2013 in Stem Cell International Journal, first ever in the world proof of concept study to show that cell therapy works in autism. The cells we used, as I said, the child's own cells, and we looked at 32 individuals over a period of 1 year, and we looked at various domains where there is a problem. Let's say social relationship, emotional responsiveness, speech and language communication, behavior pattern, sensory processing issues, as well as cognition. And we found that with cell therapy over a period of a year, we see significant improvement in all of these domains. So we see that hyperactivity reduces, understanding improves, learning improves, eye contact improves, attention, concentration, sitting tolerance, and then speech and communication and ability to do their own activities. The second publication was in 2020 in American Journal of Stem Cells, where we published a data of 254 patients. And it again reinforced what we had studied earlier, that all these different domains improve to various degrees. But most importantly, what we saw was that age matters. We found that mild, moderate, severe, all type of children do improve. But if you treat them early, if you treat them before 5 years, you get almost 98% possibility of the child improving or the autism reversing. Between 5 to 10 years, the possibility becomes 94 to 95%, and between 10 to 15 years, it becomes about 90%. So as age increases, the possibility of success, it doesn't become zero, it reduces by 5% every time. Earlier you bring after the diagnosis, better the result. That's again important, and male and female both improve similarly. So these are all the publications in the world. First from India, second from China, third from Italy, fourth and fifth from US, sixth again from India, seventh from Vietnam, eighth from Iran, and ninth from the US. These are all our publications. As such, there are no contraindications. We can do oxygen therapy along with cell therapy, and we will guide you regarding chelation biomedical when it needs to be started. Let's look at results of the recent study where we have looked at addition of integrative therapies or oxygen-based therapies. When we added oxygen-based therapies, we found that the children did better, at least 5 to 10% more improvement is seen. When you see that, if you, for example, here the blue indicates only cell therapy with rehabilitation, the red indicates cell therapy with integrative therapies or oxygen-based therapies, about which I will talk. And we found that when you do it together, almost 5 to 10% more improvement you see in many of these domains. So let's look at a few examples of how children with autism have been benefited with cellular therapy. This is a case report of an 18-year-old boy, 19 years now, who came to us first when he was 11 years old in 2015, the second time in 2017, then 2018, and he is now out of the autism spectrum. Earlier, his CAR score was 26.5, which was mild autism, and now he's almost like a regular teenager. Earlier, he had fleeting eye contact, low self-awareness, sensory issues. He had a lot of sensory issues. He would not wear like a full pant or sneakers. He would wear only Crocs. He had a lot of temper tantrums. He had limited vocabulary. Most importantly, the improvement seen is that he had earlier a third grade, fourth month reading level at the age of 11 years, and in 5 months, it became a 7th grade 1 month reading level. So this is very important. That is, understanding and reading improved, his language performance improved, his sensory issues became less, his cognition and understanding improved, attention became better. Brain scan also showed improvement, and he shifted from a special school to a regular class, and he got A's in most of the subjects. And his GPA was 3.833. So from mild autism in 2016, he went out of autism in 2018. And this is him now. He is now joined a college. He has passed high school, and he went on a trip or a college trip with his friends to different parts of the world, globe. This is the mother talking about the child.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. And I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word. We were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the 3rd grade 4th month reading level to a 7th grade 1st month reading level in 5 months.
So his autism is almost completely reversed, and we are very proud of this child. Let's look at other examples.
We went to different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye. And no child is crying, no child is waving back bye. And by then, for sure, I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came. Actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Just with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed, it takes a few minutes and he is asleep.
See my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day and we went out, and these guys could cycle. Send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
Buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
That is the strength of a mother who doesn't give up. And Rick is now almost out of autism. This is a child who came from Kenya. He came to us when he was 13 years old, extremely difficult, very, very severe, very hyperactive, no understanding, no awareness. After the treatment, slowly he calmed down, his understanding, sitting tolerance improved, socialization improved, his understanding became better. He started learning, at least going to special school where he could sit and do certain activities. He started vocalizing a few words from being completely non-verbal when he was 13 years old. And now he's better. He can swim, he can ride a bicycle. So, a lot of changes in this child, though he was 13 years old. But of course, parents had to keep trying. It is important not to give up. Now I want to show you a video of a child from South Africa. The child first came to us when he was 4 years old. You can see on the left side of the screen, the right side is after a year earlier. He was absolutely not said, not comprehend anything. But after a year after the treatment, his sitting became better. He understood more. His compliance improved. His vocalization from barely any words became better. So this is a year after the treatment on the right side. So focus better, color, understanding better. So in a year, and then we now also have a video of him. The mother sent me 3 years after the treatment, where you will see now the drastic change in a child who was completely not verbal to a completely verbal child.
Once upon a time, Pete the cat was walking down the street and his brand new white shoes. Pete loves his white shoes so much. He sang this song. I love my white shoes. I love my white shoes. I love my white shoes.
With that, making his own story and recording himself. So
Pete stands in a large pile
foundation, which was made by the stem cell
strawberries. What color did it turn his shoes?
He's very good in reading. He's better
Red.
in reading than his peers. So this is
Goodness.
South Africa. So there are many such examples in autism. I'm now going to go to cerebral palsy. So for the lack of time, cerebral palsy, severe brain damage because of lack of oxygen during pregnancy, during birth, or shortly after birth. It can be only one hand is affected, or one side of the body is affected, or lower part of the body, or the whole body is affected based on the part of the brain which is damaged. So there can be severe tightness, or completely loose body, or lot of ataxia or movements or dystonia. This is a scan, PET scan, which is showing severe damage. The black areas are completely dead or scarred tissue. The blue indicates low functioning areas. So we cannot really get the black tissue to repair or regenerate, but we can help the blue areas to become more functionally active and connect. Generally, treatment for autism would be the medication for spasticity or orthotics for legs, rehabilitation, Botox injection to reduce spasticity, or surgery to reduce spasticity. That's where the treatment is currently. However, cell therapy helps to go into the brain and help improve brain functioning and connections. So let's look at the results. The procedure is similar to what was told before. This is a data of 262 patients where we can see better oromotor, tongue movement, lip movement, chewing, speech, better eye contact, better neck control, better sitting balance. First this happens, then standing and walking, and then hand functioning. So this is how cognition improves in most or all children. So this is a brain scan. We'll see a few brain scan here. Let me show you. You can see here this brain, the blue area, all this front part of the brain is damaged and no functioning here. You can see after the treatment, the blue areas have become more green. So you can see that activity is better in the lower part of the picture. Again, you can see these blue areas are more green. You can see blue areas are more green. So all these publications scientifically, validated data. This is an example of a patient from India, from a state known as West Bengal. This child came 7 years old. He was treated about 3 years back. When he was on the severity of 1 to 5, he was a severity of 4. When he came, he could not sit properly without support. He could not stand or walk. He had poor hand-eye coordination. He could not speak. He could not understand or follow commands. He was being taught at home. After the treatment, he's within 2 years, he could sit independently. He could stand and walk with a walker. He could start speaking in sentences. He could go to school and study, and his understanding improved. His hand functioning improved. So there was a holistic improvement. His severity scale from 4, it became 3. So severity also improved. This is the brain scan. You can see before the treatment, all these blue areas, they are now green. You can see that the brain functioning has improved drastically in 2 years. Let's look at a few videos. This is a child from Kenya who came to us when he was 14 years old. He was completely wheelchair bound with the cell, and his hand function was also limited. With the cell therapy and good rehabilitation, he started sitting better. He started using his hands. He started using to do daily activities like charging the phone, going to the fridge, taking out water, opening the bottle, drinking. Simple things, very important. And from wheelchair, he is now able to walk without support. Another child, 6-year-old child, who has been coming to us for 3 years. We will see how he has improved. He could barely sit or crawl. Now, when he could not speak, he could not understand, or started vocalizing, he can identify animals. So cognition improved, speech improved. He could not crawl. When he started crawling, he could not get up. He had a lot of instability in the hand. It was difficult for him to walking or crawl. Now he can crawl and kneel, walk and get up from the floor, walk with less support. He still has a lot of instability, but walking and climbing stairs have now started. So continued rehabilitation is very important. This is another child from Kenya, 7-year-old, who could not stand. He was completely supported first when he came, and now after the treatment over a period of a year or two, he is now walking without support, first inside the house and then slowly outside. There are many such examples, and we saw the brain scan. Now I'm going to go to the next segment for intellectual disability. Again, in intellectual disability, understanding comprehension IQ is low, and we can see brain functioning is affected. There is no definitive treatment, and cell therapy helps to improve the functioning of the brain. Again, this is research we have published, where we divided 58 patients into 2 groups. One group got only rehabilitation, one group got cell therapy and rehabilitation, and this is the difference. So the blue indicate cell therapy and rehabilitation group, and orange indicates only rehabilitation group. So first, let's see only rehabilitation. 20% of the children had no improvement, but 80% had improvement, in which 37 had mild improvement and 13 had significant improvement with only rehabilitation. Now, with cell therapy, you can see that there is no child who is not improved. And out of the 100%, out of that, 10% showed mild improvement, while 62 showed significant improvement. So that is the qualitative difference in the improvements after the cell therapy. After the cell therapy, you are able to get more improvements in a shorter time. So in these children, cognition improved, remote memory improved, problem solving, understanding of relationships, social inhibition, toilet training, command form, eye contact, aggressiveness reduced, attention concentration improved. So you can see the brain scan here. This is all the blue areas. This is before the treatment. You can see after treatment, completely green, yellow, and red indicates better functioning of the brain. You can see the blue area is now green. Again here. So these are all examples of improved brain function. These are all publications in intellectual disability. This is a 20-year-old male who came from a small place in south of India. He was 20 years old, but his brain functioning was less than 9 years. old. So he had difficulty in reading, difficulty in writing. He could not play outdoor games physically. He could not speak full sentences. He had problem in calculation, social behavior. He could not interact with other similar age group individuals. He could not go out of the house alone. He could not go grocery shopping. He could not calculate. After the treatment, he started reading and writing better. He could complete his schoolwork with minimal help. His mathematical calculation up to 1,000 was possible independently. He could help his father in the shop, and he could buy groceries himself. He could now talk and converse with his peers and other people independently. He could speak with the customers as well. His cooking, he could start cooking on his own. So qualitative improvement, and his brain functioning also improved by almost like 22 months. So social age increased from 8 years, 2 months to 10 years. So many people ask me about Down syndrome. So it is a chromosomal disorder where instead of 221 chromosomes, there are 3, and there are a lot of other developmental issues apart from brain functioning. There is problem in the morphology of the face, how the face looks, short neck, sometimes heart, cardiac issues, thyroid issues, height problem. So all these other things can be taken, can be treated with medical treatment or surgical treatment. For brain functioning improvement cannot be treated, and cell therapy helps to improve the brain functioning. So this is, you can see the brain functioning here. The blue areas are now green. So the brain functioning improves after the cellular therapy. This is an example again of a 23-year-old girl or woman who had difficulty in fine motor activity. She had difficulty in understanding. She could not even recognize colors till the age of 23. She could not articulate or speak properly. So after the treatment, her color recognition improved, her understanding, number recognition became better. She could now do fine motor and combing activities. She helps the mother at home in cooking. Her aggressive spells reduced. So the cognition, understanding, fine motor activity improved even at 23. So you can see that if you get the child early, you can do so much better. So this is about neurodevelopmental conditions. So about the complications of the cellular therapy, which we do, we are taking the cells from the patient's own body. There are no major adverse events or complications, no neurological deterioration. We do see that those who have a history of seizures, there is a 3 to 6% possibility that seizures may transiently increase. There could be a possibility of a headache, a spinal headache. At 10% of the patient may have a headache, which will become okay in 3 to 4 days. And there could be some local pain. So these are issues which can be taken care of. This is NeuroGen Brain and Spine Institute, where overall we have treated over 13,000 patients from 75 different countries. This is our hospital where we are, we admit patients near a beautiful lake. This is our operation theater and the cell laboratory where the cell separation is happening. The comprehensive treatment under one roof, we believe a combination of cell therapy, neurorehabilitation, and oxygen-based therapy together helps, and we have a complete team of neurorehabilitation experts. And we believe that treatment together helps. Now we've added on other integrative therapy or oxygen-based therapy, a little bit about them. This is hyperbaric oxygen therapy, where you can see this is like a capsule, like a space capsule or a CT machine, which is just plexiglass, and the patient goes inside, and 100% oxygen at increasing pressure is administered. 100% oxygen, when it goes into the body, it goes more into the bloodstream. Here you can see 100% oxygen at normal pressure. When we are breathing normal oxygen at normal pressure, the oxygen will go only into the red blood cells. You can see here. These are the red blood cells which carry the oxygen. But when you give it at increasing pressure, you can see oxygen diffuse into the plasma. So through the liquid medium, the oxygen will go from the hair to the toenail. The whole body is now suffused or diffused with oxygen, and thereby the healing is better. So even those places which were inaccessible by blood supply or because of blockage is now accessible for oxygen. So this helps in improving the cellular age. It helps improve the brain functioning, helps stimulate the cells in our body, stimulate stem cells, which we have injected. It helps the cells to engraft properly as well. It helps repair the muscle injury. It helps improve the brain functioning. So it helps in many, many areas of our body, including autism. It helps in wound healing. So not only neurological conditions, a lot of other conditions also are benefited by oxygen therapy. But oxygen therapy cannot be done when there are active seizures. If the child has had seizures within 1 or 2 months of the treatment, if there is a visible implant, like if there is a ear implant or outside the body, there is a metal, ear perforation or grommets, or acute ear infection, if there is a fibrosis of the lung or recent lung surgery, or if the patient is on oxygen support or ear discharge or has a fear of closed spaces, then oxygen therapy will not be possible. This is how the oxygen therapy is done. This is a monoplace chamber. There are two types of oxygen therapies. One is monoplace and one is multiplace. The multiplace, you will have a room and there will be chairs and oxygen will be given in mask or in helmet kind of a thing. Here at NeuroGen, we have this monoplace chamber where the patient is inside the chamber. In children, along with children and adult will go inside and the door is closed. And then slowly the oxygen pressure is increased and then maintained for about half an hour to 45 minutes at a particular pressure. We start at 1.3 pressure and go up till 1.7 or 8 pressure. And the child is very happy because they can see cartoons or YouTube or films on the television above. And once the dive is complete, that means the pressure comes back to 1 atmosphere pressure, then the door is open and the patient is taken out. Ozone therapy is another form of improving oxygenation in our body. This is through a process of ozonation. That means oxygen is O2. We are converting into another gas, O3, which is less stable and gives rise to a molecule which is extremely powerful. You can see this ozonator here. Oxygen goes in from here and through the ozonator comes out as O3. It acts as an antioxidant, anti-inflammatory, anticoagulant, and a germicide. Improves oxygenation, regulates oxidative stress, has immunomodulatory function, very good germicidal, kills virus, bacteria, fungus, tuberculosis, everything. In children, generally given through 2 routes, one through ear using a stethoscope, ear insufflation, or through the rectal as a as an enema. These are different ways it can be given. If a patient has certain bleeding tendencies or GC deficiency or hyperthyroidism, then ozone therapy cannot be given. If the child has history of seizure, then ear ozone cannot be given, but rectal. This is how the ozone therapy is done. This is oxygen cylinder. The third integrative therapy for children is deep tissue mobilization or acupressure. Pressure at different points in our body helps to calm down the child and improve oxygenation and relax the muscles. Can be done in children as well as the adults. So generally, a combination of cell therapy, rehabilitation, 10 SGBOT, 10 ozone, and 8 deep tissue mobilization for children. This is our physiotherapy unit. This is our occupational therapy unit. This is our Autism Child Development Center. This is aquatic therapy unit. This is a spinal cord injury walking tract, where we treat spinal cord injury patients, make them walk, sensory integration therapy, for autism, teaching children how to, have a bath, brush their teeth, wear their clothes. Speech therapy unit, art therapy. This is our other hospital where we do neurological conditions and anti-aging treatment, where we do oxygen, sauna, and cryotherapy, intravenous vitamins, cosmetic therapy, other regenerative procedures. So these are different books that we have written, and all are available online. You can download them, some for professionals, some for caretakers. This is our core team of seniors of different expertise. Dr. Alok Sharma is a neurosurgeon, visionary. He is the director of NeuroGen, who has evolved this treatment protocol. Myself, Dr. Nandini, one of the deputy directors. My specialty is I'm an expert in stem cell and regenerative medicine. Dr. Jacob is the head of neurorehabilitation and a very, very senior physiotherapist. Dr. Prerna Bade, head of regenerative laboratory, and Dr. Himangi Sane is a physician and head of research, all deputy directors. This is a core team. This is our certification. We are ISO and GLP GMP certified, and we have been awarded many international and national awards. The Rose of Paracelsus Award from Europe, Best Medical Practice Award, Inspirational Company Award, Award for Disability, Blessed Stem Cell Therapy Center in our state and in India. So this is how you reach us. This is our website, neurogenbsi.com. We will also reach you. You can reach us, and one of our colleagues will get back to you as soon as possible, within 30 minutes. And we can set up a Skype interview online or a virtual consultation. You'll get one specific coordinator who will assist you throughout the process. We have two types of processes, 1 week program and a 2 week. 1 week is a basic program where the patient arrives on a Sunday. We do complete blood work, a brain scan, clinical assessment on Sunday and Monday, 1 day of procedure, and followed by our 4 days of rehabilitation and discharge with advice of what needs to be done at home. 2 weeks procedure in addition to the cell therapy. From Wednesday, the rehabilitation and oxygen-based therapy starts. Why NeuroGen? How are we different? Because there are different kinds of different therapy centers and different cell therapy centers using different protocols. NeuroGen, specialty of NeuroGen is that our focus, as the name itself tells you, is the focus is neurological condition. We do not treat any other condition, any other disorders or any other areas in NeuroGen. So cell therapy only exclusively for neurological condition. We use very safe treatment protocols, taking patients' own cells and injecting intrathecally, so safe treatment. We combine it with comprehensive rehabilitation and oxygen-based or integrative therapies. We have treated over 13,000 patients from 75 different countries. Over the last 15 years, our core team has very senior, experienced professionals who have been here together for the last 15 years. We have the largest number of publications in the world on cell therapy and neurological conditions. We have written book chapters and international textbooks. We are constantly researching, finding, better ways to evolve and make the treatment more efficient. And our work is approved by government-approved institutional ethics committee. That is most important. So in conclusions, cell therapy is simple, it is safe, it is an effective treatment, and when intervened early can help improve quality of life and help children become independent. And to think that what has never happened before cannot happen is to argue disbelief in the dignity of man. That's what the father of our nation says. So to believe that it is not possible to repair the brain because it hasn't happened before is, believing that things are impossible, which is not so.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
What we are trying to do, and I think we have been successful in many ways. So thank you for patient hearing, and I hope that this message of a ray of hope has reached you, and do pass it on to more people, because hope is important for us to lead, to get up in the morning and get about our work every day. So this is how you reach us. This is our contact email ID, and we will reach out to you, and you will get the video of this particular recording. I'm happy to answer questions now. Please do put your questions in the question answer section, and I will read out and answer each one of them. I hope this has been useful for you. If anybody has any questions, please feel free to put it in the question answer section. If there are any questions which occur later to you also, please do send us an email, and we would be happy to answer any of your questions. If there are no questions, then I will leave you to have a good weekend. Thank you for being there throughout the webinar, and I hope this was helpful. Still, if you, as I said, if there are questions which occur later to you, please do send us the questions, and we would reach out to you. Anyway, some of our colleagues will reach out to you and help you set up virtual consultations if you have any questions. Okay. Have a great weekend. Thank you.